Hi everybody, it is day 2 of the Thyroid Reboot Challenge. Just give me 1 second here. It's very noisy around here. Hopefully this will help block some of it out. Okay, so yesterday, just to do a quick recap, we talked about getting the nutrients in that can help support the thyroid functioning. And we also talked about how many things there are that can affect how well your thyroid works. And so it's not just about taking your medications. You need to do that, of course, if you are prescribed thyroid medications, and you need to take them properly. But you also need to make sure you're getting a healthy diet, varied nutrients with all kinds of different things like vegetables and fruits and different kinds of meats and nuts and seeds, whole foods primarily. And also, like I said, take your medications correctly, away from foods, away from supplements, and also helping to support your body with liver detoxification by eating those healthy whole foods. So today we're going to talk about the thyroid tests that you should ask for. I posted earlier today that something to the effect of there's a good chance your doctor will challenge you on asking for different types of thyroid tests, and I am challenging you to challenge them. And I'm asking that you find another doctor if you are not getting the answers that you need. You know how you feel. You need to take control of that and be your own best advocate. So let's just start with kind of the main thyroid tests that everybody gets tested for, and so many people are told that everything is normal. So, but they still walk away kind of defeated and frustrated because they're still feeling pretty fatigued, depressed, gaining weight, or can't lose weight. And they're basing it all off their normal lab results, all off the TSH, the thyroid stimulating hormone. So this is something that the normal range, and this varies from lab to lab. And if you got your email this morning by registering for this challenge, you have this printout that shows you this. So I would like if you could look back at your prior lab tests, or if you could, when you go in to get your testing done, get your results and then compare it to the normal range and the optimal ranges I'm going to be talking about here today. So I'm just looking down at my sheet here. So I'm going to put it up here so I can see a little bit better. Okay, so the normal TSH range is between 0.5 and 4.5. I've seen it go all the way up to 5.5, and I've seen it as low as 3.5 as the high end of normal. And so what is often said is that if you're in this range, you're considered normal and you don't have a thyroid condition. But that doesn't mean that you're going to be feeling well. The optimal range is actually much lower. It's between 0.5 and 1.5. And I talked to someone actually just a few days ago who has been dealing with her thyroid issue for many, many years, and she knows that her sweet spot is at 1.75, around there, because she is, compared her blood test to her symptoms, and she is able to know that she feels and functions her best, mostly symptom-free, when her TSH is at 1.75. That is not for the doctor or any other healthcare provider for you to figure out. That is for, or to tell you what it should be. That is for you to figure out when you are going through these testing, the different testing, and dealing with your symptoms. Pay attention to that. So when I get people's test results from their doctors, and for example, if they're up at that 4 or even 3, sometimes I've had people come to me at 6 or 7 that's outside of the normal range, and they again have been told that they are normal, that they don't have a thyroid issue. What we do is we optimize nutrients, like I talked about yesterday, in order to help that thyroid function a little bit better. And sometimes that number can come down once they start addressing some things we'll be talking about this week. And so their symptoms start to be relieved. So sometimes it can be that simple. Oftentimes it takes a little bit more intervention to do that. So TSH, like I said, because it signals your thyroid gland to produce thyroid hormone, and it gets that message from the pituitary gland in your brain. So it's an important number. It's just not the only tell. It's kind of telling us how well the pituitary gland and the thyroid gland are communicating. It doesn't tell us how much hormone is actually in our body. So that's why we need to break it down a little bit further. And that's why we go to a couple of the numbers called free T4 and free T3. So I'm just going to explain that for a second. T4 is thyroxine. That is your inactive hormone, your inactive thyroid hormone. And the majority of your thyroid hormone is this inactive form, T4. Okay. And I say you need to get the free T4 numbers because it's available to be used by the body. So free T4 just means it's available. The normal range for free T4 is between 0.8 and 2.8. And it is best, the optimal range for that is to be somewhere in the middle to the upper range of that normal range. So 1.3 to 2.8 is what we consider optimal for most people. Again, you can kind of find your own sweet spot. It does take time, but just paying attention to your patterns and your symptoms as you get tested is really important. And I know a lot of people only get tested once a year. You know, you can maybe find someone who can help you test it more than that, because, you know, maybe every 6 months or something, because things can change with stress and diet and illness and that kind of thing. So I highly recommend you get it tested more than once a year, even if you don't have a diagnosed thyroid condition. So then we have the T3 as well. So free T3 is another really important test, and this one is really often overlooked. Most docs will do a TSH for sure. They will do mostly a total T4, but like I said, I'm recommending a free T4. And I've seen most of those come back now, more commonly from most doctors as a free version versus the total number. So that is a good sign. We're moving in the right direction. So TSH and free T4 are typical. Free T3 is not as typical unless you're someone who's had their thyroid removed or killed due to cancer or some autoimmune condition, radioiodine treatment, that kind of thing. But free T3 is important because T4 converts into the T3, which is your active form of thyroid hormone. So this is what's really important. It is the less abundant hormone in your system for thyroid hormones, but it is the most active. And so if your T4 is not being converted to T3, you are not going to feel very well. You're going to be tired, you're going to gain weight, you're going to not be able to lose weight, you're going to be depressed, you're going to have imbalanced female hormones. You could very well have other hormone-related conditions, develop other imbalances. Blood sugar is a big one that comes with that. So what I recommend there, so the normal range, the normal range is 2.3 to 4.2, and it is best to be in that upper fourth category of that range. So 3.7 to 4.2 is where you want to be. If you get to the high end of that, or if you get a little bit over the high end, oftentimes people know pretty quickly because they might have some heart palpitations. And again, as I mentioned yesterday a couple times, you know, I speak from a lot of this from personal experience, and I've also seen that professionally as well. So when my free T3 range is outside of that 4.2, then sometimes or oftentimes I have the heart palpitations. So that means I need to back off my T3 medications altogether. So not everybody gets both T4 and T3 medications. So that's another part of the puzzle here too. So asking for TSH, free T4, free T3, super important. Sometimes doctors will run antibody testing. Not often, and I know this was never done for me prior to a thyroid cancer diagnosis. And you can still have antibodies even though you've had your thyroid removed or killed, but it would have been sort of nice to know if some of my issues were due to an autoimmune condition, but that was never tested back before that. So two of the antibodies that are tested for autoimmune thyroid conditions are TPO antibody. This is something that you probably should just have a baseline testing done. It's probably not something you need to run every year or anything like that. But you should get a baseline and see where you're at and see if things like this are moving around for you, because that maybe indicates a little bit more of what you can do and maybe the urgency behind how you eat and what you eat or what you don't eat. So TPO antibodies, there's a normal range, and it's just one thing. It's less than 35 IUs per milliliter. And I have seen people that are in the 300s, 400s, and their doctors or practitioners have told them they are normal, that they have a normal functioning thyroid with antibodies far above that range of 35, to the point where I questioned whether or not, because of the way the lab numbers are written, because of the 8 being so tiny, I thought it was just the way they printed it out in their system. But no, the number was 358 or something like that. And that person was sent away to be checked out for, like another year. Just wait and come back and see where your labs are in 1 year. And the problem with that is that all kinds of other symptoms can occur. You can really be damaging the thyroid gland, so there's no way of coming back from it. It might be dead. It might develop tumors. It might just totally shut down, and you can have some severe symptoms with that. So it's really frustrating that that is something that is so commonly done. I've seen that type of thing more than once in just my short time of practicing. The other one is thyroglobulin antibody. That is another antibody that can tell us whether or not there's an autoimmune process going. Oftentimes you get one or the other crop up, and you get one first and then another one will pop up later. I've seen where most people, it seems like, I don't know if there's any data to back this up, but I feel like TPO antibody shows up first. I don't think that's the rule, but thyroglobulin antibody, that's another one, a good baseline for you to get. In the normal range for that is below 20. So I've seen also where people are at 18 when less than 20 is the normal range, and they're saying, nope, you're fine. The patient will present with a lot of common thyroid symptoms, and they get kind of pushed off that there's nothing. So I look at that and say, okay, no, this person maybe doesn't need medication. They maybe don't have a full-on diagnosis of an autoimmune process happening, but we need to start addressing it like there is something going on with nutrition and some nutritional support for the thyroid gland in order to keep that away. Let's be proactive versus reactive, because you don't want to be on medications if you want. People get told that the thyroid medications are just no big deal, and for the most part, they are pretty simple. It is hormone for hormone. Sometimes it's synthetic, sometimes it's not. But there are side effects to everything we take. There are nutrient deficiencies that result. There is bone loss that results. If you're so suppressed, it can cause other imbalances and, other chronic conditions. So it's not anything you want to do if you don't have to. So let's be proactive versus reactive and get some of this taken care of. So the last one I wanted to talk about is something called thyroid stimulating immunoglobulin. So it has to do with your immune system, and it is an antibody that's looked at when people are questioning, or docs are questioning, whether or not the person has Graves' disease. And so one of the indications of Graves' disease, as you may have seen or read about at some point, is that oftentimes people with this condition have bulging eyes. They also can have really thick skin on the front of their legs. And if you have an elevated TSI, it's called, that can often indicate an autoimmune process called Graves' disease. And so what happens is that this immunoglobulin binds to tissues in the eyes, which causes that bulging effect. And it also can, thicken the skin, like I said, in the front of the legs, usually the front of the lower legs. So that's an indication that someone is suffering with that autoimmune condition. And so other things that they would look at are the other two that I talked about, the TPO, the thyroglobulin, and all the other ones that were mentioned prior. So it's a whole picture, but if they're suspicious of Graves, TSI is another marker they look at. And then also different types of radio imaging, and I think they do radioiodine for this as well, to look at the uptake in the thyroid tissue of the iodine. That's a whole nother topic. But those are my recommendations. And if you haven't signed up so you can get the ranges and you want that in black and white, I can add that below so you can see what those ranges are and have that to go on. It's not 100% the same for every single person. Like I said, that one individual I talked to recently feels perfect when her TSH is at 1.75. She has figured that out through trial and error over time. But she has done that by being persistent and being her own best advocate. And when she's told she's normal and everything looks good and she feels terrible, she's pushed for more or figured out ways to improve her health and her symptoms. So you need to really address these things and be proactive in finding someone who is willing to listen to you and not just go through the motions of what's textbook thyroid handling. Find a functional medicine person who is more versed in this. Find someone who is willing to listen to your symptoms. I know when I was at my first clinic where it's a big deal and everybody was shocked that I didn't stay there forever after 3 years of dealing with symptoms and having normal labs and just being ignored by how it was barely functioning. I left and went to someone else, and that person was willing to test more things for me and was willing to test and to allow me to try other medications. I mentioned that the other day too. So you need to be persistent, and I was lucky in finding that person. That person still is resistant to testing some other things that I've been wanting to look into based on symptoms, but we're working on that. So it's something you need to have an open dialogue. I know someone had posted, I think it was on the business page, that they get told no to, I know there's some stuff with insurance that they don't want to do that for, but I guess if people are willing to pay out of pocket for some of these tests, if they're not going to be covered based on whatever the insurance process is, and the person wants to pay cash, I don't understand why they don't. I don't know all the legalities of that, of a doctor in a clinic setting. I'm not even sure about that. But like I said, there are people that will, and it's not pseudoscience. It is real. It is legit, and it can help you start to feel better. So take matters into your own hands and get that information for you, because you deserve that. You deserve to feel amazing despite having a thyroid condition or thinking you might have a thyroid condition. A lot of people, to touch on that a second, a lot of people will fall into these normal ranges, and maybe they're the then you at least have something to work with, and you can try to optimize everything by looking at just food. I mean, how easy it is to deal with some of this stuff just with food versus having to wait until you feel miserable and then try to get medications regulated, because that's no fun for a lot of people either. So, it can take months and months sometimes. So anyway, I hope that is helpful to you. If you are interested in getting a sheet on the ranges for thyroid and optimal and normal ranges, and you can try to look at what yours have been or where they should be, and start keep a track of all that going forward. I highly recommend you do that, but just let me know and I'll make sure you get a copy of it, or I'll post it in the group. But anyway, have a great rest of your day, and tomorrow we'll be back with another topic. So I'll talk to you later. Thank you. Bye.